I'm very fortunate to have a wonderful team of people working around me. I now have about 12 vets that work for or with me, and we have a group of nurses, and we do some really amazing things. And the philosophy of our practice is that, or our group of practices, is that I actually don't care what my competitors are doing. I don't focus what I try and do around that. And everything is a moving target. We try and grow with the times, and we try and take care of our patients in a very individual and particular way, and we don't worry about anybody else. The way to fail in life is to try and keep up with everybody else. And that is also part of the distinct philosophy that I came to understand that Champion Pet Foods has. So they have their own distinct way of doing things, which when I visited their kitchens and their staff in Canada about almost 3 years ago, coming up for 3 years ago, I came away with some very disquieting questions. I wasn't converted. I still sold Hills and Eukanuba and Royal Canin, I still do. But there were some questions that I was left with after that visit and with my repeated exposure to their products that I couldn't always necessarily answer with the product offering I had. And therein lay my opportunity to help a certain group of patients that I wasn't helping before. And that has grown and grown and grown. And that's really what science is about. Science is about continually reassessing what you're knowing and updating it according to the latest available evidence. And I'm going to go through some of those things today. I just want to explain to you where I come from. So that part of South Africa down there is called KwaZulu-Natal. Limpopo is going to come into the discussion a little bit later for a second. I grew up in Johannesburg, which is a big city like every other. It's actually the world's biggest city by area and the world's biggest man-planted forest, but it's a big smoky city. Natal is a really wonderful place. We've got these big fat grey unicorns, really nice waves, warm water, friendly sharks, not like the ones in Cape Town if you're thinking of going on holiday there. Amazing mountains. It's really a lovely place, but it has its own particular disease risks. And we're going to cover some of those insofar as they're actually relevant to India as well, because there are some overlaps. So what I want to do, what I want to achieve is that by the end of this talk, you understand that your vets and yourself, certainly if you're in this room, you have a particular feeling about your pets. I mean, otherwise, why would you pay to listen to somebody like me? You're obviously very dedicated pet owners or breeders. And pets are companion animals. They are now becoming part of the family. That isn't occurring as a single wave across the world in any particular country, but that creates certain consequences as people start to have a closer bond with their animals and their animals' health care, and that the demographics of those patients are starting to change because more and more of them are living into an old age. They're getting first world diseases, and you're going to understand a little bit more about that and how we manage that in the older patient. And that comes into your relationship between the general practitioner, and I'll talk a bit about what the ideal general practitioner should be, and their relationship with specialists. And then I'm going to talk from that about proactive healthcare. Proactive healthcare is very important, not only in terms of the first world diseases, but in terms of the third world diseases. And I'm going to use rabies as an example because after India, South Africa has the highest number of rabies cases. And in my province, we have a particular problem with that. And then we'll end off with a little illustration of some of the amazing things that we are doing in Africa for animals. So there is no reason that a developing but certainly technologically adept country like India with its huge intellectual capital could not very easily achieve. And you may have to drive that as owners. I've come to understand that my colleagues are frightened, egotistical, sometimes lazy, and occasionally greedy. I'm not talking about all vets, but to motivate them to do stuff is very difficult. I estimate that when I stand up, or when anybody stands up as an expert, gives a lecture, 15% of the vets, tops, fundamentally change the way they think and act as a result of that lecture. Yet in this room, I've got a captive audience of people who want to learn and want to change things and send that message out. That's a really powerful place to be. So what I've stopped doing is trying to encourage my colleagues to send me cases or showing them how I can help them and their pets and their patients and their clients. And what I do is I appeal to the clients, I appeal to the pet owners, I inform them, and then they go to their vet and they say, and the vet says, oh, well, you know, it's got heart disease, well, maybe we can do, oh, no, but you know that there are people who fix this. And after about the third time, they say, you know what, just tell me what I need to do, and can I send the patient to you? And that actually benefits because the clients are driving more and more. They're becoming more savvy. And this really comes into your understanding of animals. So there are vets who will go to work in the morning, get dressed, washed, they go to work, and they look at their list of 40 patients to see, and they just say, okay, I've got 40 patients, and each patient is just an event. They could be doing journal ledgers, they could be counting tablets. These kinds of vets really should just be bank tellers, with no disrespect to bank tellers, but it's a different kind of task. They're not seeing the patient as a patient. The next kind of vet is the person who's an intellectual. Now, veterinary science selects some of the brightest people. So they are not stupid. But what some vets do is they say, okay, I've got another parvo case. I've got another diabetic with a low phosphate. Now what do I need to do? And they approach it like you would a crossword, and then they move on. So they can fix lots of animals, but where's the heart? Where's the concern for the patient? Then you get the next vet, and this is actually the majority of vets in South Africa, I'm afraid, where they'll say, well, I know we've diagnosed your dogs with got cancer. I've gone that far. And your dog deserves to be treated, but in a human they would do this, but it's just an animal, so we'll do that. Now, they may even treat, and they certainly feel that the animal has some rights, it has an opportunity to get better, but they deny that last bit. Why? Because they forget that a pet, when it walks through my door, the moment it walks to my door, until the client never wants to see me or doesn't need me again, or that pet is dead, it is my obligation. I take that on. And it's part of my responsibility. That's my primary purpose in life when I'm at work, and maybe even when I'm not at work. Otherwise, why would I be here? And when you start to see the pet as a patient that I have a responsibility towards, to safeguarding its health and keeping it happy, then everything transforms. Because patients deserve the best chance of a cure that modern medical science can afford them. And modern medical science is constantly advancing. There are things I'm doing today that I think about when I was a veterinary graduate. I was like, oh my God, what did we do that? I was a barbarian. But that was the best we knew then. And I'm sure that when I retire, there are things that I'm going to look back at, or people will look back at my career and say, he did what? Oh no, that's so outdated. But that is the progress. So when you take a step back and you use technologies of the 1950s or mindsets of the 1950s, James Helier or the snake oil salesman of the Wild West in the 19th century, you are taking a step back for your patient. You need to move forward. Not everything that's new is good, but at least people are working on it. Because when I look at a patient, I say to myself, look, no dog is going to come into my rooms or any vet's room and say, whoa, doc, before you say another thing, I know I've got this broken leg, but before you talk to me about plating or pinning, I do not want the first best. I do not want the second best. Please give me the third best option. What person, and therefore animal, would ever want the third best treatment when the best is available? My responsibility as a vet should be to offer you those, and then you as the owner understand the pros and cons of each. Look, I can't afford, or I don't want my dog to have a plating. Can we get a cast? It may not be appropriate for that fracture, but at least I've given you that information. But I don't believe any animal would want, and certainly deserves, inferior treatment. Why can't animals get the same health care as people? And I'm going to go and show you that animals are getting that, and there's no reason why they can't. So that comes into my obligation as a vet, and I have, 75% of my diagnoses as a specialist do not come from MRIs or fancy machines and ECGs and blood tests. They come from taking a thorough history and doing a complete physical examination, things that sometimes my general practitioners neglect. And I say to them, my vets, I have 2 ears and 1 mouth, so I can listen, and I should be listening twice as much as I'm talking. in a consultation. My consults are 45 minutes long. That may not be appropriate or necessary for most general practitioners. Don't judge them by what I do necessarily. But there are a lot of things, information that a client who spends every waking moment with their animal, that they understand far better than I can. They're a huge repository of information. They look after my patient when it leaves my room. So I ask them to get me information. So it's very important that I get as much as is relevant. I'd like to give very simple, clear options and allow the client to ask me questions. I mean, I'm a scientist. I should be systematic. I should know my information. I should be, at the same time, practical. If I have a client who comes from Richards Bay, 220 kilometers away, and there are 2 chemotherapy protocols for their dog, the one requires weekly treatments and checkups, and the one requires once every 3 weeks. If they're equivalent, it is not practical for that client to come every week, unless there is an overriding reason that they can't have the treatment every 3 weeks. It's just practical. They can achieve it, okay? But what I need to do is ensure that my patient gets the best care. And sometimes that comes from me asking myself, am I the best person to deal with this problem in this circumstance? And that's a question that not enough vets ask, and not enough clients are willing to offend the vet by asking them that. You know, I could diagnose a dog with a torn cruciate ligament in the knee, but I haven't done orthopedics in over 20 years. How could I, even though I'm a specialist, how could I honestly say that this dog's best chance of an optimal outcome is for me to pick up a textbook and try and learn that technique? I may not have the equipment, I may not have the staff to do the aftercare. I'm not always the best person. There may be somebody else out there. And you know what? When clients are referred to somebody who has that, by someone and to someone who has that approach, they do go back to their primary vet. Because when the next time the dog or cat gets sick, and they say to the vet, you're happy to treat this? And the vet says, no, I'm cool. They realize that vet didn't have an ego to hold on to the dog the previous time. He sent it off to the orthopedic vet. He must be secure in this particular diagnosis. It doesn't matter to me, and it shouldn't matter who gets the dog better, as long as the dog gets better and gets the best chance of getting better. And a big problem is that vets and clients, unfortunately, are often very reactive. They see a problem, then they react. And they don't take that as a contact opportunity, or they don't take that opportunity to prevent problems. So when my vets see a little white kitten coming for its first vaccination, we talk to them about skin cancer then, what to look for, and the many treatment options, and that when we're amputating the cat's nose or ears for skin cancer, we've already lost the battle. But there are many things we can do before. And one of the simplest things is cats are nocturnal. Keep your cat indoors during the day, let it go out at night, or just keep it as an indoors pet. So how's the advice I'm giving going to prevent a much bigger problem? And I ask myself, what would I want my doctor? What advice would I give what would I want from my doctor? Oh, yeah, take these pills. And, oh, you got prostate cancer. Oh, I suppose we could have been checking you for the last 20 years, but it just seemed like too much trouble every time you came. Or you only came in once every 3 years for a sore tooth or an itchy scalp or something like that. Instead of me telling you, you should have come in annually from the age of so-and-so, and these were the things that we were going to do. I didn't tell you that. Is that the kind of doctor that I want for my own health? And so why would I be that kind of doctor for my patient? So what happens is when you have that kind of doctor, or that kind of veterinary clinic looking after your pets, if you're the kind of owner that demands those kinds of things, your pet doesn't die at a young age from unnecessary diseases. It overcomes these things and it becomes a very old dog. So I looked at my clinic, this is from a few years back, our general practitioner. So what was she saying? Lots of young animals and lots of middle-aged to slightly older animals. Now, this is not linear. So you can see it's weeks, months, years. And these bar graphs are not entirely equivalent in terms of numbers. But look at that. I was seeing something like 4 years ago, 500 15-year-old animals. She sees 6 times as many pets as me, but I was seeing twice as many really, really senior pets. Now, I'm treating these patients. I'm not seeing them till I can euthanize them. You know, there are plenty of really nice old people out there. We don't just get them to 60 and push them off a cliff. You know, an old animal with heart disease and rickety joints and a slightly wonky brain can still get bad teeth that need to be addressed. Why must he be in pain? Because, oh, we don't want to anesthetize an old animal. It's safer to have 4 short anesthetics than have 1 long one. There's no problem with anesthetizing an old animal, as long as you do it for the right reasons and you do it the right way. Some people have to understand what that is. So what do we mean by senior? Well, for cats and most dogs, it's 7 years of age or older, but they become geriatric and should have biannual, twice yearly checkups when they hit 13 for cats, 11 for dogs. I was the proud owner of 3 Great Danes, and for those giant breeds with a shorter lifespan, we do use a slightly different scale. So a 9-year-old Great Dane is actually a geriatric. So what happens when these dogs get old? They get something called homeostasis. So homeostasis is your body's ability to adapt to changing environments, and there's a lot of leeway. Okay? But as you get older, that reserve narrows, and your ability to react to insults or things like a bit of dehydration because it's a hot day and you've run around chasing the monkeys, it narrows. Or when you have an anesthetic to have your teeth cleaned and you're a 12-year-old dog. It doesn't mean you can't respond appropriately, and many do respond appropriately, but some don't. And that's because organs decline at different rates for different individuals as a result of their previous 15 years of life and genetics. You know, if you want to live a long, healthy life, there are only 2 things you need to do. So pay attention, because this applies to you as well. Okay, you need to eat, drink, and exercise with moderation, and you need to choose your parents carefully. Okay, so you have 3 old dogs, and you can see if we look at all of their organs, they're all the same age, they're all in the same homestead, they've eaten the same thing for 15 years, they might be from the same litter, but they may have different organ function in different things. You look at some of these adverts and you see this woman, you think, she's 70 years old and she's Jane Fonda, and she's got this beautiful skin. Why can't I have skin like that at 45? It's genetics. But Jane Fonda might have a rotten liver, and mine is looking great. We all age differently, even within our own bodies. So there are some symptoms of old age that I want you to look out for. Abnormal drinking, abnormal urination, easy bruising. Changes in weight are a very important sign of a disease. I'm going to show you something in the middle. Is this counting down? Oh, thank God. There's a timer here, and I thought, I haven't spoken for 51 minutes already. Mobility issues, changes in behavior can be a sign of old age as a decline in organ function. Okay. But there are many reasons animals may have a change in behavior when they're old. They could be sore from arthritis or dental disease. They could have doggy Alzheimer's. It's a disease of old people, old dogs as well. I don't even know how you pick up Alzheimer's in cats who are, as a rule, generally are schizophrenic psychos. But, high blood pressure, we're going to talk a little bit about that later. Thyroid problems, over or underactive thyroids can change a dog's behavior. So there are many reasons for changes in behavior, and they shouldn't just be brushed away. Some of them have very important health implications. I'm going to skip through this and show you this dog. This dog's X-ray. This dog was sent to me. I was the 5th vet to see it. The dog had been losing weight and poorly appetent for 5 years. And I took a history, and then it turned out that nobody had asked what preceded the 2-year history. Other dog had had a dental. I contacted the vet who had done the dental. Yes, he took dental x-rays. Because when I examined the dog, there was a sore area in the mouth. Now remember, I'm the first person to find these things, but I'm not the first person to look at this animal. And the others have been trained professionals. So we went and took this old dog, anesthetized it. The other vet took x-rays but used a normal x-ray plate, which is inadequate. We have a dental x-ray machine. It was a substantial investment in time, money, and very difficult to learn to use properly. But what did we diagnose? When this dog had its dental, a tooth root was left. For 2 years, this dog's had a tooth root sitting in its mouth. We took the tooth root out, the animal ate. The owner was livid, not with me. But then the referring vets say, oh, but I'm not going to spend 200,000 Rand on a fancy dental x-ray machine. Well, but I have it here. You want to take a dental x-ray? Bring it. We'll do the dental x-rays. Then you can go back and you do your dental. So those things are available, but people choose not to grab hold of them. And that speaks for a lack of empathy and attention to detail. Mobility. I've put lots of old dogs to sleep for arthritis. And something I'm going to be talking about tomorrow at one of my talks is that younger people, millennials, are 50% of them will go to diet as a solution for their dog's mobility issues, whereas older people will tend to be quite happy to take a tablet. So there are many ways of managing mobility issues, but dogs, I put a patient to sleep on Mondays, joints just couldn't take it anymore. What a shame. Because that dog's obesity had not been managed for years, and I was getting it at the tail end. It was just too much to deal with. But there are many reasons why animals may have reduced mobility, and there's no reason for an old animal not to be able to move. And then there's breathing abnormalities. Any animal that is resting in a cool environment that has more than 50 breaths per minute may have significant endocrine, cardiac, respiratory disease, or pain, and should be investigated. It shouldn't be brushed away. But these are not just the simple things. This cat has asthma, for example. Look at it. What quality of life does that cat have? We're going to give that cat an inhaler. You can teach cats to use an inhaler. It's very easy. Then there's no systemic side effects, and this cat is still alive. It's still a patient of mine. Okay? Vision and hearing often go. Cats and dogs often get misdiagnosed of having cataracts when they're older. These are not cataracts. They are thickening of the lenses, which is perfectly normal. But some of these vision abnormalities, like retinal detachment, tell you a lot about other diseases, like high blood pressure causing retinal detachment. I defy any vet to look at an animal and tell me it is normotensive or hypertensive from the outside. I can't do it. Nobody can. You need a machine to measure blood pressure. So what do you do with all of this information as the owner? The first thing is keep records of your own animal. Keep their vaccinations up to date. Keep their parasite control up to date. Go for annual health checkups. The minority of what you're paying for is the vaccine. You should be asking for, demanding, and getting a contact opportunity with your vet with that patient. If you have medical aid, take it out. If you don't, take it out. Maintain it. And then we do some age-related management screening. But it's really about prevention. So here at my clinic, if you book your animal in, and I saw you yesterday, my staff will insist your patient is reweighed. That's why we get weight charts like this. And I'm going to show you about this animal, for example. Small amounts of weight change can be very important. Take an interest. When we do blood tests on animals, we store them on the computer, but the printout I give to the client. It's their record. It's very important. They start to track what I'm trying. And this comes to age-related screening. So what we do for cats and dogs is slightly different. But this is an expensive machine. But once you learn to use it, and it is tricky, this thing pays for itself. And suddenly you start to understand the value of blood pressure monitoring, for example, or routine blood screening. So what if I told you that 25% of cats 11 years and older are hypertensive? And hypertension is a killer. It's a silent killer. We understand that from people, right? So 1 in 4 elderly cats are being undermanaged if their practice does not have and regularly and appropriately use a blood pressure machine. You're missing a whole opportunity to help a whole bevy of patients. They aren't cheap machines, but they do pay themselves. Mine has paid itself off something like 16 times in the 10 years I've had it. Dogs, for example, heart disease is quite important. This is a Doberman. Now, what if I told you, what are we doing there? We're doing a 24-hour mobile ECG that's strapped to the dog goes home. We do that in Dobermans and boxers because they are prone to something called dilated cardiomyopathy. What is the value in knowing this? Okay, so these dogs have a heart scan by me or somebody who knows how to do proper echocardiography, has a proper machine, and they have this monitor every year from 2 years of age. Why? Because if we pick up a positive animal that's, say, 2 or 3, and we have, I've got a patient that I saw about 4 weeks ago, 2 years old, it's already got occult cardiomyopathy. I put that patient on a medication called Vetmedin. You are going to delay the onset of symptoms by 2 years, and when they do get symptoms, they live an average of 2.5 years. So I've added 4.5 years to their lifespan. Do you know what the lifespan is of a dog once it's diagnosed with congestive heart failure due to dilated cardiomyopathy? 42 days. It is a massive increase by proactive screening. This is one illustration. This would not be an appropriate test for a Bichon Frise dog or a Yorkshire Terrier. It can be appropriate in specific individuals, but not as a screening test. So you need to individualize your screening, which means as an owner, be aware of the important things for your dog's breed, its lifestyle, its age, its environment. So you need to identify these risk factors so that you can manage them. Another one that I want to point out is, for example, a very important thing that's ignored, sarcopenia. All of the others I've talked about. Sarcopenia, the loss of muscle mass. What is muscle? But a very protein-intensive organ or tissue. How do you maintain muscle? Amongst other things, you feed an adequate protein diet. This nonsense that dogs can't have a high protein diet has got to stop. And you're going to be my evangelist. You're going to go out there, and when your vet says to you, oh, that's too much protein, BS. That's all you're going to say. A dog can easily tolerate and should require, particularly when they get older, higher levels of good quality protein. It's phosphorus that is a problem for the older dog's kidney. And people conflate the two. They are not the same. And not all high protein diets are high in phosphorus. My dog has kidney failure, and he has a condition where he requires low fat. But he needs protein because he keeps losing it because of his stomach ulcer. So I find it very difficult to feed my dog. But he is on a low phosphate, high protein diet. An elderly miniature schnauzer with kidney failure. And people say, oh my God. But then they look at my dog and say, he looks amazing. I'm not killing him with protein. I'm keeping him alive. So you need to understand the risk factors and manage them appropriately and get rid of some of the dogma. So ways that we can manage risks. I use an example. This dog, my assistant, Dr. Ratner, is removing a lung tumor. You know, lung cancer, oh, it's terrible. 70% of lung tumors that we see in dogs are curable with surgery alone. They only occur in old animals, so we're not operating on young dogs. So how do we make it safe? We have trained assistants, one to monitor. All she's doing is monitoring that anesthesia and reacting accordingly. She has appropriate equipment to monitor, help her monitor a patient. We have a proper anesthetic machine. I have a nurse. Having a nurse helping Dr. Ratner operate reduces surgical time, reduces risks. Okay? So it is an additional cost, but the cost of the nurse's fee plus 250 Rand cuts down on about 2,000 Rand of operating time and frustration. We have time-saving improvements, so then things like this, safety. We put those patients on fluids. We have a ligation machine which does electrocautery. It cuts down bleeding, so we need less blood. There's better wound healing. There's better wound healing times, shorter healing times. We have the patient on a ventilator. These are not expensive medical devices. Well, that one is, but these ones aren't. Dr. Ratner is using this device here to remove that lung tumor. She can get into the chest, remove an entire lung lobe, and be out, and the dog is off anesthesia within 60 minutes. Her record is 45 minutes. She's not trying to be quick. We give her tools that save time, because shorter anesthesia is safer. A more bloodless anesthesia is safer. Okay, that's what we want. And this dog made a full recovery. It's still a patient of mine about 4 years later. I also am one of 2 laparoscopically certified surgeons in South Africa. And this is a way for me to investigate patients in ways that could only be imagined. So for example, this dog on ultrasound and bloods did not give me a true reflection of how bad this dog's liver was. We put an endoscope in. This picture doesn't do it justice. It's an amazing picture. And I looked at that and I thought, oh my goodness, we're in a lot of trouble here. This is a lot worse than I thought. Now the client is trying to decide whether to treat their pet or put it to sleep, or what's the outcome. We can make 2 5-millimeter holes. You can imagine there's almost no discomfort from that, almost no risk of bleeding compared to a standard laparotomy. We can take a look around. We can take a biopsy. We can control bleeding. Now, to give you an idea, from there to there is 4.5 millimeters. That is a small instrument. That is a small biopsy. That looks like a dramatic amount of blood. It is really not. It's less than my thumbnail. And this dog was awake within 45 minutes, went home that afternoon, had a diagnosis 4 days later, which said, look, it's terminal. let's put the pest to sleep. But there are many who are not. But that requires that somebody takes the effort to learn, which means they need supportive clients or people that demand this of them. I mentioned Gosforth, that a cat with the weight history. At 12 years of age, Gosforth was brought to me and I diagnosed him with gastric lymphoma. Look at that cat. That is just terrible. Not an unloving owner. This owner is an accountant. He has a record that thick of this now deceased cat's history. He took daily records every day on Excel spreadsheets. The patient was put on chemotherapy, had a blood transfusion when she, a few weeks later, went and got tick bite fever, so we treated that. This cat lived 4 years, didn't die of either of the 2 cancers it developed or the kidney failure. It got a broken jaw because it was just old, and it got into a fight with the Labrador and broke the jaw, and there was not enough bone to fix it. And so we couldn't leave it. This dog didn't die of cancer, went through a whole course of chemotherapy, 7 different drugs. Then it got liver cancer. We removed that liver tumor. You can achieve amazing things if you have a proper team around you. And regarding team, you're talking about vets. Vets should be going to ongoing, continuing professional development. And I think, as I said to you, I have this frustration with some of my vets. I think that they come to these events, the company sponsor them. We do our own symposium once a year. It's coming up in February. They come to these talks, they sit there, they socialize with their friends, they have a couple of beers, they have dinner, they collect their 3 CPD points, and nothing changes. That's not continuing, because it's not ongoing. They're not developing, and then therefore they're not really good professionals. There are vets who sit there. They can sit at the back or sit at the front, and they're constantly learning, and they go back and they tweak their approach. They change something all the time. That's the kind of vet you want to select for your pet. Okay, you can have lots of certificates, but know nothing. Okay, it's really important that you keep abreast and that you update things. One of the things we do as a practice is that we have group consent. We sit down and we say, do you guys have Spirocirca lupi in this country? I don't know if anybody knows that. So we sat down and we said several years back, a product came out, it was licensed for the prevention of treatment. We had nothing for it before then. And we said, we shouldn't be treating this disease. Okay? Let's eliminate it. We're going to all advocate to our clients that we're going to get rid of this disease, that they must put their patient on this treatment. We're going to switch our tick and flea and our deworming medication to get rid of it. We were diagnosing 2 cases a week, basically 89 cases a year. We're now diagnosed 2 a year, and they're always referrals or new clients. That is me meeting my responsibility, but we agreed to it as a practice, and it was important in our setting. We don't try and treat Lyme disease because that doesn't occur in South Africa. These are important things. It's also important, I don't know if you guys have many specialists in India, but the vets should feel that they have access to those specialists for advice and sometimes referral, and the specialists should be accessible. Some specialists are not. They get very arrogant and they are extremely unapproachable. They don't share anything. They don't share any knowledge. They're not trying to grow the vets. Doesn't take anything away from their capabilities or their abilities, but it is a huge pity. And then, as I mentioned before, proactive healthcare. I'm going to talk a little bit about this. So we have a small thing. Here's what your vets should be doing. Small class, sitting with a veterinary radiologist. She's teaching them techniques. We got machines lent to us so that they could practice. And at this class, in fact, they diagnosed one of my dogs with an adrenal tumor. I didn't even know it was there. Had no sign of it. So the important thing is these vets in this room, these guys are all wanting to learn. They've paid to attend this course. That's the kind of person you want to deal with. We do client education evenings every 2 months, as we have clients just like the people in this room who want to learn about things. And these people are the advocates for proper healthcare. It's going to take 2 or 3 generations of dogs' lives or pet ownership to change the way your friends see pets. But it's very important that you are spreading out a sober, thorough message. Because otherwise people are not aware of new techniques. And I'll talk a little bit about this right at the end.